The issue of lifting these COVID-19 restrictions and returning to some sense of normalcy was covered a lot in today's news conference, as Governor Northam says the steps to take that Virginia has been taking to stem the tide of COVID-19 has been working. Governor Ralph Northam says starting Friday, elective surgeries and procedures can resume in Virginia. They were paused 5 weeks ago to preserve hospital space and protective gear in case there was a surge of COVID-19 cases. But Northam says steps taken to slow the spread have been working.
Our hospitals have not been overwhelmed. We have been able to get more PPE and developed ways to decontaminate masks and gowns.
One hospital official says the shutdown has cost Virginia's hospitals over $200 million.
But that is insignificant. The more important thing to do was to build the capacity within our hospitals.
Northam adds this also means Virginia has hit the hospital capacity and PPE benchmarks needed to begin phase 1 of reopening the state. The governor also clarified another benchmark they're watching, the percentage of positive cases, and says they're looking at trends versus day-to-day changes, but adds,
our numbers haven't flattened out yet.
Northam wouldn't commit to giving employers the green light to reopen their doors on May 8th when an executive order closing many businesses is set to expire, but he says they continue to work on the details of that reopening plan, including the possibility of doing it at a regional level.
We're really trying to think through this with thoughtfulness and reason and fairness, and at the end of the day doing everything that we can to keep Virginians safe.
Northam also touched on if schools will reopen in the fall, noting it's a question he gets a lot, and says if things continue to trend the way they are,
we're all working as hard as we can to make sure that your children, our children, are back in school in late August, early September.
And one other thing of note from today's news conference, state health officials say in the coming days they will start changing how they report cases of COVID-19 in Virginia and will start breaking that down at the zip code level.